Good evening once again. It's a pleasure to have you join us here on Rwanda Television News with me, Gloria Mutisi. Starting us off tonight, more than 3,000 people across the city of Kigali were vaccinated against COVID-19 on Saturday. These include members of the civil society, industrial workers, and employees of private security agencies. The Rwanda Biomedical Center says the speed at which the vaccination campaign has been done is impressive. Vaccination campaigns against COVID-19 pandemic in the country entered week 2 in Rwanda. In the city of Kigali, this Saturday, various people, including religious leaders from different denominations and staff at private security companies, are among those that received the jabs. Recipients of the shots shared their sentiments.
I've just been vaccinated and I'm feeling good. It means a lot that Rwanda was among the first African countries to get the vaccines. We have to get vaccinated because for every illness, God has also provided medicine for it.
Industrial workers in Kigali Special Economic Zone were vaccinated in the Prime Industrial Park located in Masoro. Satis, who resides in Rwanda, is one of the workers in the economic zone who was vaccinated, and he says he's glad that they were thought about and given the vaccine.
It's been almost 5 minutes. I'm perfectly fine. No issues. Just 2 days after the president has got the vaccine, His Excellency has got the vaccine. If I can get it so soon, I'm very happy that, we are going very fast.
Uwinkindi Francois from the Rwanda Biomedical Center says that the vaccination program is going well and that they are ensuring that every category in the population will be vaccinated.
The vaccination is going well. Many people have received their first jabs, and we prioritized people that are highly exposed, and we vaccinated a cross-section of people, so in all categories of people. There are some that are vaccinated.
It's been slightly over a week since the COVID-19 vaccination campaign began in Rwanda. Figures provided by the Ministry of Health show that as of the 12th of March, 249,074 people had been vaccinated across the country. Let's also inform you that this Saturday, President Paul Kagame, who is also the chairperson of the AUDA-NEPAD Heads of State and Government Orientation Committee, received the CEO of the AUDA-NEPAD, Ibrahim Mayaki. Following the meeting, President Kagame took to his Twitter to mention that he held a productive meeting with Mayaki today. President Kagame also added that Mayaki brings wide experience and new ideas to the AUDA-NEPAD. Now, moving on, experts in epidemiology have been saying that overlooking COVID-19 prevention guidelines is another form of fueling the spread of the virus. They're warning people against being complacent. Gabi Muvunyi has more.
In different parts of Kigali city, there are several residents seen being reluctant in following the set preventive COVID-19 guidelines. It is evident that some choose not to wear their mask in a right manner, avoid washing their hands regularly, and ignoring the social distancing rules.
These people cause problems to us. We stayed at home for more than 3 months because of people like this that do not follow instructions. And it's not good manners. I try to advise my colleagues to follow the COVID-19 guidelines.
For nearly a year now, youth volunteers have been at the forefront of the fight against the pandemic, monitoring and reminding the public to adhere to COVID-19 prevention measures, especially in crowded places.
Standing here at the bus park gate, I have to ensure that people are properly washing their hands. We also have to ensure that buses take only 75% of the passengers, which means 55 people on the bus. One can find at times those numbers increase. We interact with different people. Some can be very hard to deal with, but it is part of the job.
Dr. Menelas Nkeshimana, expert in infectious diseases, says that the prevention guidelines have had a significant effect toward the fight against COVID-19.
Back when the specific areas in Kigali had a spike in positive cases, we would test the residents in the affected districts. But now, we do not wait for them to approach us when they have symptoms. Instead, we go to their homes to test. That way, they can be treated before the symptoms worsen. The positive cases are then controlled to a certain number.
Dr. Ngeshimana says that no one should be complacent in terms of the pandemic because anyone can catch the virus. Dr. Sabine Sazimana, the Director General of Rwanda Biomedical Center, says that although some people have already been vaccinated, observance of the measures in place to fight the pandemic should be continued.
Dufite kimwe mu nyongera z'ibyo twifashishaga kurwana na COVID-19.
The vaccine is here to help with the fight against COVID-19. But it is clear it cannot replace the other things such as the preventive measures. However, for us to try and beat this pandemic by the end of the year, it requires us to be patient, and for those that did not get infected to continue adhere to the guidelines, and for those that got infected and beat the virus, they should also be careful because one can get infected more than one times.
Yarabashije kuyikira ntirare.
According to the statistics by the Ministry of Health, so far 20,000 people have reportedly contracted COVID-19 as of March 12, 2021, and 18,000 have already recovered. The death toll stands at 273. Gabi Muvunyi for RTV.
Now, still on COVID matters, health officials say that for the world to overcome COVID-19 pandemic, a large number of the world population should be immune to the virus through getting the COVID-19 vaccine. Ghislaine Mugwaneza has this report.
Currently, a sizable number of people all around the world are getting COVID-19 vaccine. Health workers say that the main goal is to share it with the rest of the population worldwide. More than 3.9 million people got infected with COVID-19 in Africa, with more than 106,000 deaths recorded. The director of the Africa Centers for Disease Control and Prevention, Dr. John Kengasong, says that the arrival of the vaccine on the African continent will reduce COVID-19 death cases.
We, as a people of 1.2 billion people, will continue to invest in our own health security, our economic security that increasingly is being threatened by COVID-19. It is in this perspective that we look forward to working with all countries that will be receiving this COVID vaccine to ensure that they are distributed effectively, provide the appropriate support from the Africa CDC and partnerships that will enable us to distribute these vaccines in a timely fashion.
Through COVAX vaccine sharing scheme, 22 African countries out of 54 have already received COVID-19 vaccines. It is expected that Africa will receive at least 600 million COVID-19 doses through this program. Kengasong says that apart from the vaccines that Africa wants to buy through African Union, there is a special summit that is expected to be held in April this year that learns on how African continent can start doing COVID-19 vaccines by themselves. So far, some of African countries are getting COVID-19 vaccines from India, China, and Russia that have already done vaccines by themselves. The World Health Organization announced that it has listed the one-dose J&J COVID-19 vaccine for emergency use, which adds a more agile option for immunizing people in developing countries. The one-dose J&J COVID-19 vaccine is the third to be approved by World Health Organization to be used for emergency use, after Pfizer, BioNTech, and AstraZeneca. Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, said that COVID-19 vaccines are helping the world to fight the COVID-19 pandemic.
More than 335 million doses of COVID-19 vaccines have been administered globally so far, and no deaths have been found to have been caused by COVID-19 vaccines. But at least 2.6 million people have been killed by the virus, and more will continue to die the longer it takes to distribute vaccines as rapidly and as equitably as possible.
Tedros also said COVAX program will soon receive 500 million doses of the new approved J&J vaccine. Almost 8 million people get vaccinated per day. In 335 million people that have already got vaccinated, more than 75 million have got 2 needed doses to protect them from COVID. Health officials find it's better to increase the number of people that get vaccinated, which will boost the immunity to the virus. Ghislaine Mugwaneza, Reporting for RTV.
Many thanks, Ghislaine, for that report. Now, while Gisagara district is one of the few districts in the southern province that continues to see an increase in the COVID-19 infections, some locals point out that their counterparts are abstaining from COVID-19 prevention measures. Residents are demanding that anyone who will be arrested for violating the guidelines should be heavily punished. Ethan Tashabia reports.
The area known as Amayaga in Mamba, Jikongo, Gishubi and Musha sectors of Gisagara district have seen a spike in new COVID-19 cases in the past few days. Residents say it is largely because of some of their peers that are reluctant to adhere to COVID-19 prevention guidelines. They find it necessary to take strong measures against wrongdoers, such as tightening sanctions, as that is what will make others fearful.
I think it is largely due to complacency among people. People don't seem to take prevention guidelines seriously. We get reluctant despite constant reminders from health authorities.
It is necessary to take strong measures against wrongdoers. That is what will make everyone understand the importance of these guidelines. Alice Musabyezu, a statistics officer at Chibirizi Hospital, said that they have been recording new COVID-19 patients. The health facility has since continued the campaign to prevent the pandemic from spreading, with testing some people who come to seek medical care for various illnesses without realizing they had contracted COVID-19.
We work with different stakeholders, including local leaders and community health workers, to sensitize people on control measures and contact tracing and testing people who come to seek medical care. Due to
the increase in the number of COVID-19 patients, the district administration has put effort in testing the virus in all health centers, according to Gisagara District Mayor Rutaburingoga Jerome. More efforts are needed, especially among some areas where they have been reluctant. We are focusing much on contact tracing and testing everyone who visits health centers and isolate those who have tested positive to reduce the spread of the virus. As of March 12, 2021, according to the figures released by the Ministry of Health, Rwanda had recorded 20,057 cases of COVID-19. Among those, 18,361 have recovered, 1,421 are still sick, while 275 people have been killed by the virus. At the same time, over 250,000 people have been vaccinated as of Friday, March 12, 2020. Reporting for RTV News, Ethan Tashabia.
Now, moving on, manufacturers, real estate developers, as well as importers of construction materials are pleased with the decision by the Rwanda Development Board to exempt them from all the taxes they've been paying as a way of recovering from the losses incurred because of the COVID-19 pandemic. We have this report. The Rwanda Development Board has decided to lift all taxes on the domestic manufacturing, construction, and real estate development sectors. The initiative, christened Manufacture and Build to Recover program, aims to help these industries increase domestic production, increase exports, and reduce imports. Aim Ndayambaje from Hippo and Emmanuel Shimiimana from Wild Urban, who is constructing an 11-story building that will cost more than 2 billion Rwanda francs, acknowledge that this will lead to development in the sector.
If we'd buy things with VAT inclusive and now it's been removed, that means that we'd be able to buy so much more because the price has reduced. And as from the industry sector, we'll profit from it and it will increase how much work we can do, hence the development of the country too. When we locally buy things here in Rwanda without the VAT, it is easier for us. Even with the important taxes off now, it's going to be easier for us and it will enable us to get to Vision 2050. The taxes were a big challenge because the money we were paying was a lot, which was discouraging. But this will even attract investors to the country. In
2018-2019, the construction sector alone generated more than 600 billion Rwanda francs in revenue and increased by 4%. Dennis Carrera, the CEO of Savannah Creek Development Company, says that the incentives that come with manufacture and build to recover program will be a major milestone in Rwanda's construction industry, specifically providing more jobs, among others.
The house I ordinarily sell for, say, 100 million, for example, if I take out the VAT, if I take out the import duties, it means it will probably reduce by some 20%, 30% or so, making it affordable for you, the buyer, to buy the house from me. Now, when I make it affordable, you, the buyer, therefore, in order to occupy your house, you are able now to also go to a supermarket to equip the building. So the manufacturer who is manufacturing items, the what we call FMGs, the fast-moving goods, used in day-to-day life, is going to manufacture much more. Manufacturers on one hand will benefit, and us in the industry also, in building industry, are going to benefit because we will be able to put up these homes, provide homes to people. People will then be able to consume items from different manufacturers. Now, whereas on our part also, we shall be able to sell homes at affordable prices.
RDB's Deputy CEO, Zefanini Yonghuru, says the program's primary target is to increase the number of jobs and boost Rwanda's post-COVID economic recovery.
The target is to increase the overall industry the output that we get from the industries, and also be able to recapture the domestic market. There are several essential items from those three categories that I mentioned, especially when it comes to fast-moving consumer goods, which are heavily imported, while we could actually produce these products here. So the target is to be able to recapture that domestic market. And then the target is also to catalyze the creation of more jobs. With the pandemic, industries were affected, and there are also other sectors that were affected. But we believe that if we increase the overall output from the industries, we be catalyzing also the market in terms of making sure that we actually don't have our investors going outside to import.
Statistics released by the Rwanda Development Board show that due to the COVID-19 pandemic, investment in 2020 fell by 47.1% compared to 2019, as investment was valued at $1.3 billion, while in the previous year it was $2.46 billion. When it comes to investment in the construction industry, real estate and construction and manufacturing accounted for 68% of all investments registered in 2020 at 48% and 20% respectively. According to the Rwanda Development Board, a total of 24,703 jobs are expected to be created by the new investments, with the manufacturing and construction sectors expected to create 8,661 and 6,372 new jobs, respectively. The government aims to create 214,000 new jobs every year from investments and other employment sources. Well, that's it for tonight. Thanks for your company. As always, a gentle reminder to please wear your face mask and do all that is required of you to stop the spread of the pandemic, because no one is safe until we all are. Otherwise, God bless you and keep you. And until next time, I'm Gloria Mutesi.